Our next speaker, Mr. Rajeev Ronanki, is the Chief Digital Officer at Anthem, Inc. Mr. Ronanki's experience spans over 20 years of innovation-driven industry and social change across healthcare and technology. Under the leadership of Anthem CEO Gail Boudreaux, Anthem embarked on what has been called a digital transformation just 3 years ago. Mr. Ronanki is leading that work to help Anthem become a digital platform for health that utilizes a multi-channel approach to connect consumers and providers. To achieve this transformation, Mr. Ronanki drives the vision, strategy, and execution of Anthem's digital-first approach across the organization's digital, artificial intelligence, exponential technology, service experience, and innovation portfolios. He is reimagining the future of healthcare by enabling Anthem to harness the power of AI and data. Today, he's going to talk about how healthcare organizations and plans can contribute to AI that advances health equity. Mr. Ronanki?
Thank you, Sherry. Pleasure to be here this afternoon with all of you. And I was glad that Dr. Jones and Dr. Fay preceded my talk here because it sets a great context to kind of how Anthem is looking at this very deep and I would say critical issue at a population level. And the reason I say that is Anthem is the second largest insurance company in the US. We cover 45 million lives. And as a result of our longitudinal relationship with the populations that we serve, we've got access to over 70 million claims data for over 70 million lives. We've got access to clinical data for over 15 million lives, and we've got access to lab data for over 18 million lives. And we've got a wealth of socially oriented data on where people live, work, play, and their access to health-related or the drivers to health-related, health issues, if you will, or social drivers related to health issues. And through all of that, and by no means this number here that I've put up on the slide is necessarily peer-reviewed and critically validated. But in all of the analysis that we've done, we've found that roughly 80% of an individual's health outcome is determined by where they live, as opposed to let's just say their DNA or any other health factor. So clearly, all the things that we just talked about are critically important to sort of driving health equity and using all of our techniques and all of our interventions at our disposal in order to address it holistically. But before we dive into that, let's maybe set some context, right? So as I said, a lot of the health-related issues are driven by where we live, work, and play. Where we live, for instance, Dr. Fay talked about economic disparities and other social factors. But breaking that down a level, what that means is where you live, does it have access to affordable and nutritious food? Are they adequate recreation and exercise options? Is there access to medical care? Are they, pollution levels in the air and the water? And is there reliable transportation? All of these things, have a huge impact on health, as do where we work. And does the place that you work, does it provide health insurance coverage? Does it provide and focus on whole health issues, connecting in primary clinical needs with behavioral health issues, as well as accounting for all the things that create stress and other things in our life, leading to health-related outcomes and health-related issues, and ultimately social factors of health. Our friends, our family, are we lonely? Do we have a good support system? And what kind of behaviors is that driving? Healthy behaviors, or is it driving unhealthy behaviors like eating unhealthy foods, drinking, and smoking? All of these things have a role to play in our health outcomes. So the role of artificial intelligence then, right? So given the wealth of data, and given the fact that data is growing at an exponential pace, and in our own research, it shows that Anthem's data set roughly doubles every 73 to 80 days. So it's impossible for humans to keep pace, with the exponential growth of this data. So enter artificial intelligence. It's a long, well-established field. It's been around for 40 plus years, and it goes more and more mature, by the day, by the week, by the year. But a lot more to be, done in terms of responsible and the ethical use of artificial intelligence in order to address the very many things that we're talking about. So how do we actually apply AI, and how do we correlate it back to the issues that I just referenced around driving more health equity and improving access to care, and using all of this data ultimately to drive better health outcomes? So here's just a few examples of how Anthem is making that happen. So first up, we've got something that we call a data platform for social determinants of health, and that platform. And you can click on that URL to get a sense for what that looks like for you in a public setting. But the private version of that combines where we live, work, and play, and all of the associated data around that with our clinical data, with our claims data and our labs data, and increasingly data from our devices, to create a number of predictions. And today we're able to predict roughly about 4,000 unique things about a person's future healthcare journey. Everything from the likelihood of developing an opioid substance abuse disorder, or developing a chronic condition like hypertension or diabetes in the future, to the risk of falling, the risk of skipping an appointment, the risk of missing a critical gap in care, and ultimately suffering a worse consequence as a result. So what do we do with all these wealth of insights? Collectively, we have over 2 billion such insights. And there's two ways in which we're activating and making use of these predictions. One is through our partnership with our provider network, which comprises of primary care physicians, caregivers, physician extenders, nurse practitioners, of course, hospital systems, home health providers, and the entire gamut of the healthcare care delivery infrastructure. And through our relationship with the broader care delivery infrastructure, we're integrating our insights into the electronic medical records and other points of data and workflow in a physician's office or a hospital system to get them to see the whole picture of health. And those are oftentimes clinical insights, but more and more they're about social insights that relate to fairness, equity, and conclusions that physicians might draw purely based on race, ethnicity, and gender, and some of the basic things that are used today. But looking beyond and saying, does this patient that I'm seeing have access to transportation? Come see me for my next appointment. Or does this person have enough time, in their day to spend their time exercising and sleeping well and looking after themselves in a way that would address, their medical and their behavioral and their social well-being. Put all that into the hands of the clinician, so that not only can they treat what's presented, but also look beyond and look at the whole picture of health, and take care of that in their workflows. So while presenting this information itself is useful, what we've also come to realize is that to truly make this actionable and have the providers be a part of this closed loop sort of mechanism for taking care of these interventions, is to actually incent them to do just that. So to do that, we've created and expanded our value-based care programs, where we align the incentives and the outcomes for each provider based on the number of actions that they're taking on the insights that are being created by our algorithms. And we want both the feedback on what's working and what isn't. So if they're taking action and they're seeing an improvement, we want that feedback to come back to us so that we can continue to optimize our algorithms. As well as if they feel that the insight that we're surfacing is not relevant and is not appropriate for that particular patient, we also want to understand why that's the case, and then also use that to continually optimize and refine our algorithms. So think of that as like one bookend of a platform that needs to be in place. The other is the direct activation with our members, our consumers, which happens through our digital apps and our assets, as well as our clinical and customer service teams, which interact with our consumers. And as you would imagine, as a large insurance company, we get hundreds of millions of interactions that happen. Some that happen digitally. About 60 to 70% of our interactions with our members happen through digital channels, and about 30% of them happen through our contact centers. So regardless of which channel our members are reaching out to us on, or we're reaching out to them through, the intent is that with every interaction, we want to understand the context in which we're resolving an issue. So if a customer is calling us about let's say an administrative issue about the status of a claim or a particular benefit or a copay or what have you, we always want to correlate that to what is the related set of dots that we should be connecting. Are they missing an appointment, or are they programs that we should be enrolling them into, and making them aware of it, so that we're raising the education level of the collective membership that we're caring for and serving, as well as we're providing recommendations to our provider network on the specific actions that they ought to be taking. And in so doing, we want to create this virtuous cycle where providers are incented to do the right thing based on our insights. Our members are also incented through, for example, eliminating copays and providing rewards and loyalty program and doubling points in some cases to take certain actions based on the whole set of insights that our algorithms are surfacing. But in so doing, there's a critical dependency of making sure that we're accounting for things like bias. We're accounting for data quality issues in our underlying data sets to make sure that the insights that we're servicing are actually representative of the complete population, and that we're not missing anything because we're simply using machine learning techniques to learn from perhaps what's an embedded bias in the system already. So to that end, we've created something that we call the Office of Responsible Use of AI and ethics, and this group continuously looks at data, but tests for bias, as well as uses several other techniques to make sure that these things are used in a responsible and scalable manner. So in a future that is so much technology centric and is going to be leveraging data and AI in such a scale manner, our view is that we've got to use technology in a way and AI in a way that elevates the human experience. So to that end, our strategy is to really use these technologies to automate as much of the administrative processing in our system as we can, freeing up enough time across the system, whether it's the physician's time, freeing them up from having to rely on their electronic medical records, more than necessary, or any of the 85,000 people that work for Anthem to focus almost exclusively on what are the things that need to be considered in balance of whole health, and spend their time there versus resolution of a claim status or a billing issue or a prior auth that needs to be decided on. All of those things could be automated and decided on by algorithms, and then the rest is where we want to focus our time on, and so doing, elevate the the human to human interaction and the human connection. So with that, I will turn it back over to you, Sherry. Thank you for your time, and appreciate being on this panel today.